Hello. Is
Oh,
that working
Caroline,
now?
hello. Yes, hello, hello. Welcome. It's
Oh,
lovely to
thank
have
goodness
you
for
here
that. I had that
today.
wee
Yes,
panic then.
yes. You're here now.
Oh,
Now I'm going to be your glamorous assistant, so you'll just have to. I'm not sure it will work perfectly
fabulous.
well. So just prompt me when you're ready. So would you like to start?
Uh-huh.
Oh,
Yeah,
hang on.
go for it.
Can you
Yeah,
see?
bring up
Can you
those
see your
slides.
slides? Can you see them? Oh, I don't think I'm
I
sharing my screen.
can't see them yet,
No.
but that might just be because they're coming through.
Can you see them now?
Yes, I can see them now. Yeah,
Okay,
and I'm hoping
perfect.
everyone else can.
Yes, I think so. If you
Fabulous.
can.
Okay. Hi everyone. My name is. Oh, am I ready to go?
Yes, you're ready to go. Are you there?
Okay, perfect. So I am. Can you not hear me?
Yes, yeah,
Can you
I
hear
can
me?
hear you now. I think you're dropping
Shall I
out a bit.
shall I keep going?
Yes, just tell me.
I'm wearing a headset. Shall I try it without the headset?
It might be better. Can you hear me?
Yep, I can.
Okay. So can you see the slides?
Okay. I can see the slides. I can hear you. Can you hear me?
I can. So you just tell me when you need to move to the next slide.
Okay. Yeah, move to the next slide and I'll start by introducing myself. So I'm hoping this is working, everyone, but my name's Caroline Crocker. I'm the People Development Manager for Public Health Scotland. So really what I intend to cover with you today is just a little bit about the organisation I work in and give you some of the examples of how we're using data science and hopefully make those really relevant for the current situation we're facing in terms of the pandemic. So we're incredibly involved with that right now. So I was hoping to give some examples of how we're supporting that. Give you a bit of information about the sort of data science journey that we've been on as an organisation, where we're at and where we hope to get to. Talk about the sort of full skill set we look for as an employee, and also sort of how to stand out of the crowd when you're in the marketplace and looking for your job, what it is that really stands you out. So that's hoping what I'm going to get covered in the next sort of 15 minutes. Do you want to move me on? So Public Health Scotland, if there was ever a time to have a marketing campaign done for you as an organisation, I would say it's right now when we're in the pandemic with COVID-19 and aligning that to launching a brand new Public Health Scotland agency on the 1st of April this year. So it wasn't planned that way, but it's certainly how it's happened. So we were planning to open Public Health Scotland for a while, and its key responsibilities are really focusing on the public health challenges that we've got across Scotland. And you can sort of see there on the slide in the sort of purple area, some of the key areas that we need to, as an agency, address. So looking at things like the place and communities, improving people's health, early years, mental health, well-being, tackling things like alcohol, tobacco and drugs, having an inclusive economy and also having a healthy lifestyle. These are massive, big challenges for Scotland that our agency is sort of leading the way to support, but we can't do it alone. We are a collaborative organisation and we've been set up to work really, really closely with lots and lots of different agencies across Scotland. That includes Scottish Government, the health boards, local authorities, third sector like charities, etc. So we really are working throughout Scotland in so many different areas. And one of our biggest challenges that we found ourselves supporting literally as we opened the organisation has been COVID. That was something that has built and built, and has meant that our organisation has had to pivot and realign our workforce to really support that over the last 6 months, and will continue to do so going forward until we move into much more of a recovery phase. So that's central to what Public Health Scotland is all about right now. My role is not the technical data science delivery. So please hold back on any questions in terms of technical, what are we doing to support COVID? My role is very much looking at the workforce development requirements around that and supporting our workforce in terms of thinking ahead for the future. So skills that we need, how we can work alongside organisations such as the Data Lab. So we partner in terms of student placements on this programme, and I've been involved with that for the last 3 years. We do things like university internships, so undergraduates working with us in their sort of middle year. And I also support things like apprenticeship programmes, so taking in school leavers or into modern apprenticeships. We do technical apprenticeships, and we also do graduate apprenticeships in data science. So we've got a sort of pathway through our organisation as well to support learning. So that's sort of, in a nutshell, our organisation. Can I have the next slide, please? So let me just give you some of the examples of where we are sort of using data science. Next slide. So as I said, sort of COVID has become one of the massive areas that our workforce has had to pivot and support. And one of the key things that we've done has been to create a sort of public-facing dashboard where members of the public can have a go-to place to find all the data they need on COVID. And that's been pulled together as a sort of collaborative piece of work from ourselves, Public Health Scotland, but working with National Services Scotland, working with Scottish Government, but also working with other lead agencies who are collating data. And then we pull the data into this one portal where we can put it out to the daily statistics we've got. And that breaks down per neighbourhood and the trends in terms of the demographics. All of our teams are working hard to get that updated each day. Next slide, please. Other work that we do as well for COVID is more in terms of data science techniques in modelling. This dashboard, I'm stepping ahead of myself. This one is early warning surveillance. So this is looking at taking data that comes in maybe through NHS 24, calls that are people displaying symptoms but maybe haven't been tested. So doing some sort of predicting of where we're maybe getting growth hotspots in terms of COVID. So that's sort of this side of the dashboard. Next one, Miriam, please. And then I think the next few examples I've got is the sort of modelling work that we're doing as well, using sort of techniques where we can look at predictive analysis. So we're looking ahead and going, okay, where are the sort of predictions in terms of growth? What are the sort of mortality rates telling us, and what's the modelling to say those could go up to? And then the next slides as well, we do modelling in terms of how the systems can cope with that. So what's the patient pathway flows through the health and social care systems, and can they cope with the numbers that we're predicting may come through? And then we also have to do modelling to help look at things like service capacity. So in terms of health and social care services, what's the sort of predictions and the modelling telling us, and therefore can they be prepared? Then there's also the predictions in terms of recovery time. When we start to come out of this on the other end, we need to look at the services that have been put on hold and how we're going to then replan all of those. So again, there's all the work going on in the background to help us into that phase. So that's just some of the examples of where we're supporting this effort and using techniques. And there are sort of people in our organisation that are working literally around the clock on this. It's been a huge, huge piece of work, and will continue to be so for a long time. Do you want to flick to the next slide? And beyond that one, next one. So other things that we do, and this just I thought would be useful for you, is we do put an awful lot of data onto an open data platform. So that slide before this one was just telling you of the open data sources that we provide. So I don't know if these slides are made available to everybody, but those links there will show people how to get to the data if they want to do some analysis themselves. And then I've just got here another example of how we use some data science techniques, which include using our Shiny. So the Scottish Burden of Disease is a huge big study we've been involved in for a number of years, which forecasts disease and injury rates. And if you just bring up the next slide, please. These examples just show how we've used our Shiny dashboard to sort of look at some of the different ways of presenting the burden of disease. So we've got here tree map visualizations and heat map visualizations that have been developed. So that's just another couple of examples of how we're using technique. Can I just move on to the next slide? So our data science journey, next slide. It's a long road that we've got to go on. I would say, where are we now? Oh, if we just go back one step. Oh, jumped on. The data science journey, I would say that we're on. As any workforce, there are varieties of staff skill set across our organisation, and I would say the students that we take on, the graduates of programmes such as this one, are really leading us through that journey because they're joining our organisation with really advanced skills, which we need. The journey we're on is making sure that all of our existing workforce as well keeps their skill set maintained and keeps advancing the skills that they've got. I would say a career in data science never stands still. So the techniques you're learning today and this year will keep changing and will keep progressing, and new techniques will always need to be considered. So that's one key element, I think, as an employee we need to really stress, is that people who want to keep their skills high and are self-motivated to do that is really, really critical. Move on a couple of slides. And the skills that we really value when we are sort of bringing people into our organisation. Obviously, the technical skills that you bring are absolutely fundamental to what we need you to be able to do. But I think it's equally important to really think about the complementary skills that go alongside the technical, and that will give you a really all-rounded sort of skill set to offer. Huge proportions of our work is about working in collaboration. It's very rare that someone will go off and develop tools on their own without actually engaging in working with others, working in a team, working in collaboration, whether that's cross teams internally, whether that's collaboration with other agencies, other organizations, and being able to work in a group setting and bring your skills along with other experts to solve these problems together is something that's critical. User-centered design is something as well that we really, really see as important. So what I mean by that is, who will be using the data products that you are developing? Because we must always start with those users in mind. So very simple analogy of that was me thinking about this presentation today. Who would be my listeners? So the first thing I did is go back to a student who was in your shoes last year and say, right, what do I talk about? What's most interesting? And asked him as a sort of user in my situation to say, right, what do I talk about? So making sure that you're developing work, you listen to the users, you engage with the users, and you bring them with you on the journey of development. That's absolutely critical. And you do that in a sort of project management and agile way. So these are sort of skill sets as well we're really valuing. So project management is about mapping out your timelines, breaking your work down into deliverables, and actually engaging with your customer or your user every step of the way. Don't go off for 6 or 12 months and design something and then go, ta-da, it's ready, because you're probably going to have missed the mark. So when we talk about agile methodologies, we talk about short iterations of work, share it, test it, get feedback, take that on board and get to the next stage and go again, develop something, share it, test it, take on board that feedback, go again. And that moves you slowly forward to getting the right product designed. Those techniques go hand in hand with the technical, and those are the sorts of things that will really take you far. And the other bit that goes hand in hand with your technical skills is the sort of communication, storytelling, presentation skills. To be really technical is fantastic, but you have to be able to explain what you're doing to everybody else in the room. I come from a non-technical background, so for me, I need to have it really spelt down, back to basics. And I love that quote from Einstein: you've got to be able to understand it to be able to explain it to your grandmother. So that's sort of something that to me, be able to explain what you're doing. Next slide. And I think finally, this is just some advice, and I think this was covered by some of the panel just before I've come on board, but what do we look for and how do you stand out in the crowd? Some key bits of advice I would say is look for every opportunity you've got to enhance your skills, network, get involved, hackathons, anything at all that gives you experience. When you're applying to organizations, do your research. Don't just rock up, but be able to knowledgeably talk about the organization you're applying for. And make sure, I think somebody else was mentioning this in their advice to you, but know what's really important to you, what drives you, what motivates you, and what you're passionate about. Because if you can find that organization that aligns to your values, you will be your most happiest. And I think Shona as well has also said from the panel is your job where you go to first is a journey. So I've come a route from fashion retail and I've ended up in healthcare statistics. I've gone private sector, public sector. It's all given me the experience I need to get the role I'm in today, and every bit of that experience counts. So each job will lead you towards the next and will layer and layer and layer your experience. And I think the last thing I'd love to say is don't stop learning, keep your skills up, be self-motivated to keep those skills enhanced right through your career journey, because that is what will stand you out in the crowd. And the last thing I want to just say is good luck on your career journeys and on this program.
Thank you. Oh, I'm on. Yeah, thank you so much, Caroline. Are you still there? Yes, thank you so much.
I can hear you.
You can hear me. I think the sound isn't very good from your system, but that was fantastic. Thank you so much. I'm just looking to see if there's any questions. I think we're actually running out of time. So if we have any questions, Caroline, we'll come back to you offline. But thank you so much.
Feed them through to me, that's fine. I can answer them offline. Yeah.
Okay. Thank you so much.
Pleasure.
Thank you very much.
Bye.
Goodbye. Goodbye. So,
bye.